Good evening once again, gentlemen. We'll look at the meaning of diabetes, organic diabetes, even the one or your sugar. This is where the blood the glucose levels are above the normal. And someone may ask, what is then the normal that it needs to be above? The normal for humans, usually the fasting blood sugar less than 100 milligram per deciliter, and the random less than 140. We'll come to this later. The most important substance or chemical they involved in diabetes is insulin. This insulin is produced in the pancreas. Pancreas is one of the small organs in the abdomen. The insulin, if on a locally, it helps glucose. Remember, glucose actually in eli most times. It helps the glucose to enter the cells so that they will be utilized or used inside the cells. But if what happens in diabetes, Buna, either that the body is not able to make enough insulin na the pancreas, or that the body is not able to use the available insulin at all. Then coming to the second part, the types of diabetes we have. Actually, there are many types, and many types of diabetes, but here we'll be mentioning three common types, though two of them be the most common, so many people about. We'll mention the three common types that include the type 1 diabetes, the type 2 diabetes, and the gestational diabetes. Type 1 diabetes now occur carry it's usually mostly present in younger people, less than 45 years. Is not as common as the type 2 diabetes. The type 2 diabetes is the one that occurs in mostly elderly people more than 45 years, while the gestational diabetes is transient or what we call temporary, usually temporary form of diabetes, increase the sugar level in pregnant women. It's important to mention this here because many of us will have our wives, we have our sisters, we have our female relatives that may be facing such challenges during pregnancy as well. Because I know there is no woman in this group, but we have our relatives that are females that may benefit from the information here. So in the type 1 diabetes, it's usually because of insulin, lack of insulin, the pancreas is not able to produce this insulin. So there is deficiency. While in type 2, the insulin may be there, but the body is not able to use it. The cells are not able to use this insulin because they are now resistant to the effect of the insulin. The risk factors for diabetes. These risk factors are things that we can refer to as things that can increase the chances of someone developing diabetes. Remember, it's usually difficult to answer the question, what causes diabetes? Because there are a whole lot of things that can come together to predispose someone to having a diabetes. So the specific, if you want to say now the specific cause of diabetes, if you want to pinpoint it, it's actually not known, it's unknown, but there are factors that can make someone to develop diabetes. So for the type 1 diabetes, which is usually the one in younger people, in children, is mostly autoimmune. Autoimmune means that there is something produced by the body that shouldn't be there, shouldn't be produced. So these substances produced by the body will now go and attack the pancreas and make it not to produce insulin that the body requires. Because insulin is not produced, the glucose in the body cannot be used, so they now become high in the blood. So this is usually the risk factor, autoimmune diseases. And if you have a first degree relative like father, mother, or brother and sister that also has this type 1 diabetes, then you have higher chances of also having it. Of course, as I said earlier, type 1 diabetes is mostly in younger people. So younger age is another uh, uh, risk factor for it. Why type 2 diabetes risk factors? You have age more than 45 years. If you have a previous gestational diabetes, that is in pregnant women that have previous gestational diabetes, then they can also have a predisposition to type 2 diabetes. Overweight, if you are overweight or obese, you have high chances of having type 2 diabetes. If you also have relative father, mother, or brother, sister that has type 2 diabetes, then you can also have it. Also, of course, if you are an African, you have higher chances of having uh, type 2 diabetes. Smoking cigarettes also increases the risk. Physical inactivity also increases the risk. Having high blood pressure also increases the risk. Most of these will increase the risk by causing insulin resistance. That is, the body will not be able to make use of the insulin produced. Many of these factors are also responsible for gestational diabetes, many of them as well are responsible. Family history, overweight, previous gestational diabetes mellitus will also predispose you to another one. Uh, and hormonal disorders like polycystic ovarian syndrome can also predispose women to gestational diabetes. All these factors can all be grouped into two: modifiable risk factors and the non-modifiable risk factors. Modifiable means that those risk factors, you can change them, and non-modifiable means that you cannot change them. For example, if you are an African, you cannot change it. You might change one neighbor, an African. But if you have been smoking, you can change, you can stop smoking, and the risk factor will go. The risk factor for smoking, the smoking risk factor will disappear from your own table. So this is just the meaning of the modifiable and non-modifiable risk factor. Then what are the symptoms of diabetes? Many of us already know these, at least many of these symptoms. We might have come across people that have the symptoms, maybe in our family or our friends or somewhere. Or many of us have known these symptoms as long as we've lived. So you have frequent urination. Someone will be passing urine often, every time, urination. You have excessive thirst, hunger for water. You want to drink water every time. You just want to drink water. And then the person may also have weight loss, unexplained weight loss. It's not as if na on actual shape or not eat, no, but the person will now be losing weight. Then also extreme hunger every time. And I go Casionya. Unlike before, this time around, that goes up and down. Then wounds, wounds that will not just heal, or sores that will not just heal. Before, someone will wound, it heals within few days, but now the wound has refused to heal. It raises suspicion. Then maybe visual changes, that fuzuz of ma, or the eyes are beginning to fail, having blurry vision and all that. Then you start wondering, a tingling or numbness in the hands and feet. You have like tingling sensations. Now your hands and feet, sometimes you will not be able to feel your hands or your legs very well. Some people when they maybe a stockings no or a glove when they are not wearing any stockings or when they don't have any gloves on their hands, then the person can feel excessively tired most of the time, tired, and also maybe there will be increased the frequency of infections every time. Bone or urinary tract infection or another form of infection every time, recurrent infections. Note that some of these symptoms may also resemble symptoms of other diseases. But when a medical personnel sits down and analyzes the symptoms and also orders the relevant investigations, he or she will be able to know whether these symptoms are directly coming from diabetes or another sickness. At this section, we'll look at the diagnosis. How do we know for sure that someone has diabetes? Well, apart from the history and the symptoms and the examinations and everything that must have been done before now, there are some investigations that can tell if someone has a diabetes or no. These investigations will include the fasting blood sugar we mentioned earlier. In normal people, it's less than 100 milligram per deciliter. But quickly, I will also add here that when we say 100 milligram per deciliter, less than, there is also what you call hypoglycemia, that is low blood glucose, which is also terrible. So if this blood sugar is less than 70 milligram per deciliter, it's also a point to worry. Then, but in diabetic patients, the fasting blood sugar is usually more than 126 milligram per deciliter. And of course, you can also do random blood sugar, and you can also do glycated hemoglobin, which is hemoglobin A1C. These all have their different values for diagnosing diabetes mellitus. And it's also usually important to repeat these investigations. That is not basing the diagnosis on just one reading. It's also important to repeat them, for just to be sure of the accuracy of the reading. At this section, we look at the complications of diabetes. Diabetes comes with some really, really serious complications. And the truth is that, yes, diabetes can kill. Diabetes can kill if not properly managed. So the complications, I've grouped them into acute complications. Acute are the ones we can refer to as sudden complications, sudden. And then chronic complications. Chronic complications are the ones we can refer to as taking long time to occur. So the sudden ones we include the low blood glucose, that is called hypoglycemia in medical terms. I try as much as possible to use less medical terms in this presentation. So low blood glucose, very common complication in diabetic patients. Most times it results from use of insulin or some few other hypoglycemic agents, that is few other medications treat diabetes. It's also important that when we mention these acute complications, that we know the signs, so that if we see somebody having such complications, we may be able to detect and maybe do something. In low blood when somebody has low blood glucose, the person may be shaking, the person may become shaky, nervous. You may see the person sweating profusely, sweat everywhere. The person will be having heat everywhere, may have chills, and person may be confused as well, and may also be breathing fast. You see the person gasping for, air, breathing very fast as well. It's an emergency, actually. And if you happen to be around such a person, the best point of action is to find any a sugar available, or a soft drink that has sugar, and rush it down the person. Once the person can drink it, the person will be fine. While you now, you know, get to hospital and find out reason for the hypoglycemia in the first place. If it requires adjustment of the drug dosage or the insulin or whatever, then it will be done by the physician seeing the patient. Another acute complication is hyperglycemia. This one, high blood glucose. Maybe the person missed drug dosage, or maybe the person ate diet that is not recommended, or took a lot of soft drink, that the person should not have taken. So the person may now have very high blood sugar, and they may have increased urination, very dry skin, vision may become blurry as well. So this is another complication. Then you have the other ones, diabetic ketoacidosis, that can even lead to coma. In diabetic ketoacidosis, there will be ketone in the urine, and there will be a metabolic acidosis in the blood. All these are just medical terms. But the important thing is that once somebody that has diabetes is feeling funny in any way, make sure you get the person to the hospital as fast as possible. Another acute complication, you have a hyperglycemic state, HHS. These are all part of it. Then the chronic complications, you have diabetic retinopathy, which is eye problem. People with diabetes are prone to having eye problem, especially if the blood glucose is not controlled. There may also be nerve problems, the one we refer to as neuropathy. There may also be diabetic foot. In diabetic foot, that's the one you see them cutting the legs of diabetic patients sometimes. What happens in diabetic foot is that because the nerves are affected in uncontrolled diabetes, the sufferer, the patient, can no longer feel sensations around the legs. And even when there is injury there, the patient will hardly notice the injury, and before you know it, it becomes it gets worse and can even become gangrenous. So even at the point the patient is noticing it, sometimes it becomes difficult to heal also. Before you know it, infection sets in and gangrene forms, and then the legs may become unable to be salvaged, and then it will be cut off. So that is diabetic foot. Then another complication, chronic complication, is the patient can have heart attack or stroke, because in diabetes, the blood vessels become affected as well. We have deposition of many materials that shouldn't be deposited there. You have them depositing on the blood vessels, clogging up the blood vessels and causing blood flow to be affected. So all this can lead to stroke in the brain and heart attack in the heart. Then you also have kidney problems, nephropathy. This can also develop in diabetic patients. That's why you see some diabetic patients coming down with kidney failure and needing dialysis. You see also some diabetic patients coming down with stroke, as I mentioned earlier. Then you can also have tooth problems, periodontal diseases. In men, you can have erectile dysfunction. In fact, diabetes can affect almost all the organs of the body. This is where this gets interesting. At this section, we will look at managing your blood sugar. So there are a couple of ways one can manage one's blood sugar level. Usually, we start with a lifestyle modification. Lifestyle modification involves a lot of changes to the way we live, the way we do things. In fact, it's holistic, it's totality of how we live. So in lifestyle modification, it's advised to stop smoking for smokers. Stop smoking. Cigarette smoking worsens the risk of developing diabetes by 30 to 40%. Type 2 diabetes, cigarette smoking. And for people that have diabetes already also, cigarette smoking negatively affects glucose regulation, because it does not help the cells, the body, to utilize insulin. It causes insulin resistance. So this is one thing that it is advised to stop entirely, not cut down or anything. So it's addiction. It's difficult to stop, but the advantages of stopping cigarette smoking far outweighs any other benefit someone can derive from cigarette smoking. Then another lifestyle modification is to be exercising yourself at least 30 minutes a day for 5 days in a week. At least 30 minutes. This exercise is not expected to be vigorous exercise or so intense or heavy exercise. No. Even something as simple as walking fast for 30 minutes is a form of exercise that someone can try. Walking fast. You must not go running or jogging, but if you can, it's fine. But if you cannot, you can take walks, brisk walks, fast walking, 30 minutes every day, 5 days in a week. That will be fine. And also, you avoid sitting down in a place for so long. Sitting down in a place for so long, you avoid that. More than 30 minutes, when you sit for more than 30 minutes, you get up, stretch yourself, move around, and continue sitting again. Then weight loss. For people that are obese or people that are overweight, weight loss is very important. Losing weight helps in control of blood sugar level. As a matter of fact, there are some diabetic patients that when they lose weight, the diabetes goes into remission. I did not say the diabetes gets cured, but it goes into remission in the sense that the symptoms may disappear and they respond better also to treatment. That's about weight loss. Then, for those that drink alcohol, it's important to drink moderately. And the problem now is the definition of moderate is the problem here. You drink moderately, or if you can, avoid alcohol intake. Avoid alcohol completely if you can, but moderate drinking it's okay, it's acceptable. Then, very importantly, in this lifestyle modification, eat healthy. Now, somebody may ask, what does it mean to eat healthy for diabetic patients? What does it mean to eat healthy? There's one plate diagram we usually use to teach this about eating healthy. When you have your plate of food, you divide this plate of food into half. Divide it into two. I mean, one half of it, that is half of this plate, you should have non-starchy vegetables. Vegetables, healthy vegetables, non-starchy in the half of it. The other remaining half, you divide it again into two, the other remaining half of the plate. We divide it into two again. One of those, which is like 1/4 of the entire plate now, you have your lean protein. Lean proteins like heart-healthy fish. You can also have your chicken there. In that half portion remaining, that is like 1/4, 1/4. Then the other 1/4 or the other half, that is 1/4 remaining, you can have your carbohydrates. It's fine to have your rice, your gari, your swallow, anything you have there, just that 1/4 of plate. So you don't have to fill the entire plate with gari or carbohydrate and then have little vegetable or protein. No, it should be the other way around. The carbohydrate should be less, should be 1/4. Your vegetables should be half of your plate, and your lean protein should be 1/4. That is, your protein should be 1/4 of your plate. There are some food to also avoid in diabetic patients. In so many places they don't talk about avoidance entirely, but we talk about using very small quantity of those food, not eating a lot of them. They include saturated fats. If you can avoid them, fantastic. But even if you have little of them in your meal, there's no problem. Saturated fats like butter, beef. Yes, I know so many will be surprised to hear this. Beef, beef, cow meat is preferable to use chicken instead of cow meat. So even if you must have cow meat, it should be little. Then hot dogs should also be avoided. Also avoid the trans fats like these, the kind of fat you find in processed foods or baked food, baked goods and food. You can avoid those type of fat. Cholesterol, also better to avoid. You can find this in egg yolks, in liver, and those offals, organ meats. The organ meats. Also avoid high salt diet, high sodium. If you must use salt, it should be very small quantity of salt. You don't need the salt to be everywhere out there. So for these, if you can get a way around this diet, this menu for healthy diet, it will be fantastic. But if you cannot and you have a dietitian around, this is their domain. A dietitian will be able to create a meal plan for the entire 7 days in a week for you or for your parents or for anyone, and it helps to improve response to treatment for diabetic patients. Still on managing your blood sugar level, in the first part we talked about lifestyle modification. The second part we'll talk about now the use of medical therapy. In medical therapy, you have the insulin injection. Usually, this is for type 1 diabetes mellitus. In type 1 diabetes mellitus, they usually need insulin injection. There are many types of insulin. It is beyond the scope of this discussion, but the medical personnel attending to any patient with type 1 diabetes already knows different types of insulin and the ones that the patient in question will require. Then for patients with type 2 diabetes mellitus, these patients are usually older patients, more than 45 years, usually. It doesn't mean younger patients cannot have it, but usually older patients have type 2 diabetes mellitus. They require oral medications, medications for diabetes, mostly. And then sometimes when the oral medications are no longer effective, they switch to insulin. They switch to insulin. Then another way of managing your blood sugar is by recognizing and treating the complications. Remember, we talked about complications before now. Your ability to recognize these complications and treat them accordingly and urgently also can make the difference between life and death. Because if a patient is hypoglycemic, has very low sugar, and the patient is sweating, feeling confused, and having nervousness, and you don't act quickly, you don't give the patient sugar at that point immediately, or give soft drink at that point immediately, it may be too late. Or you delay rushing the patient to hospital on the spot, it may be too late. So it makes the difference. Identifying these complications and treating them immediately makes a whole lot of difference between a patient that lives and the one that dies. So let's all know these signs and symptoms of these complications and be able to save lives. Then another way of managing your blood sugar level is by going for your regular hospital follow-up visits. It's not the type of disease that one will say, oh, I don't have time to go for checkup today, I will try next week. No. Life itself is bigger than all the other struggles that we are passing through. Without life, where else are we going? Without the life, are we going to go to our shop? Are we going to go to the business that we do? Are we going to go to our workplace? No, we will not. So it's better we attend to our life first before any other thing. So there is absolutely no reason to miss your appointment if you have appointment for your sickness. At this section, we will talk about prevention of diabetes. I think this prevention is a part that everyone should try and understand and also share the message. Of course, we have a popular saying that prevention is better than cure. That statement remains true. It remains true every day. It will not be so much hard work. It will not be so much hard work to do things that will help to avoid developing diabetes mellitus, because the hard work involved in caring and taking care of diabetes mellitus is huge. So whatever hard work that one can put in to prevent developing diabetes is worth it. Now, there are 3 levels of prevention. These are usually the global known standard levels of prevention. So it also applies in diabetes. You have the primary prevention. These are interventions before diabetes itself occurs. These are interventions that are done. So these interventions usually involve altering the risky behaviors. We talked about the risk factors. We talked about the modifiable and non-modifiable risk factors. So the primary prevention has to do with modifying, or it has to do with changing those modifiable risk factors for developing diabetes mellitus. So stopping smoking will help to prevent development of diabetes mellitus. Drinking alcohol responsibly, moderate drinking, or even not drinking at all will also help to prevent development of diabetes mellitus. Healthy eating, making sure that we are not overweight, exercising, regular exercising, all these will help to prevent the development of diabetes. These are all primary prevention. Then secondary prevention will involve screening from time to time, screening yourself, checking your blood sugar, sometime from time to time, to make sure that you are not developing diabetes. Because some people may even have diabetes and they don't even know. It becomes dangerous because you don't know you have it. And before you know it, you start talking about the complications. You're getting complications. You don't even know you have the disease and you're already having complications on top of it. So secondary prevention will involve getting tested from time to time to make sure that your blood sugar is in order. Then, of course, tertiary prevention is when someone already has the disease, diabetes, and then one is now managing it, and one is also going and screening for any complication. So when somebody has diabetes already, a person has to screen for other complications, see the ophthalmologist, the eye doctor, to make sure that the person does not have any eye problem, retinopathy, diabetic retinopathy, Of course, do some other investigations to make sure that the kidneys are in order and the other body organs are in order. So these are all tertiary way of preventing diabetes. These are levels of prevention. Then back to the question I posed earlier before we started. Back to the question: does eating sugar cause diabetes? The answer may not be as simple as yes or no, but the statement itself, when we look at the statement at the surface level, the answer is no. Eating sugar does not cause diabetes. However, eating excess sugar, too much sugar, can predispose someone to having diabetes. Not directly, but indirectly. This is how it works. When someone eats excessive amount of sugar on regular basis, the sugar is not able to be used totally for energy production by the body because it's in excess. So the excess sugar is stored as fat in the body. And when that fat accumulates, the individual develops overweight. And as we already learned during this presentation, that having overweight or obesity is risk factor for developing diabetes. So that way, the excess sugar causes fat accumulation, then leading to overweight, and then possibly leading to diabetes. So eating sugar alone does not cause diabetes, but excessive sugar consumption can lead to developing diabetes through getting the person involved overweight. Thank you. In summary, diabetes is a serious disease, and there is prevention, early detection, and management helps to keep its serious complications away. If diabetes is discovered early enough, the complications can be avoided.